Our today's topic is the gastrointestinal bleeding. So, first of all, you should know various terms like what is melena. Melena, it is a medical term that refers to the passage of dark, tar-like stool that contain blood. So, that is a sign of bleeding in the upper gastrointestinal tract, such as the stomach or the small intestine. So, when the amount of the blood lost is less than 50 ml and the bleeding is originating from the proximal GIT tract, so when the amount of the blood lost is less than 50 ml and the bleeding is originating from the proximal GIT tract, that is the upper GIT tract, including esophagus, stomach, and the duodenum, it is known as minor or low volume bleeding. So, what are the causes of the minor bleeding in the proximal GIT tract? That can include peptic ulcers, gastritis, esophagitis. What is Mallory V tear? So, Mallory V tear, it refers to the tear in the lining of the esophagus. That is the tube that connects the throat to the stomach. So why this condition is seen? So this condition is usually caused by severe prolonged vomiting, coughing that is associated with the alcohol use or eating disorders. So what are the symptoms that you will see? You will see vomiting, blood, or you can see the blood in the stool, abdominal pain, difficult swallowing. So in most of cases, the bleeding that stops on its own. So the treatment you can do is the stop alcohol consumption, avoid certain medicine that can irritate the stomach lining. So endoscopic procedure can be done to stop the bleeding, like uh, clips may be applied to the site of tear that promotes healing. What is hematochezia? It refers to passage of bright red blood from the rectum or the anus. So typically with or the coating the school. It is a passage of bright red blood from the rectum or the anus. So when the bleeding is fresh and it originates from the lower gastrointestinal tract, that is the colon, rectum, and the anus, it is known as lower GIT bleeding. So the lower GIT bleeding, the lower GI bleeding, it is associated with variety of conditions like hemorrhoids, anal fissures, inflammatory bowel disease like the Crohn or ulcerative colitis, diverticulitis, colon polyp, or the cancer. What is hematemesis? It is the vomiting of the blood that can be bright red or looking like coffee grounds. So the blood that comes from the upper GIT tract such as esophagus, stomach, or the duodenum. So the cause could be peptic ulcers, esophagitis, gastritis, varices, etc. So what are the causes of, first of all you should know is what are the causes of upper GIT bleeding. The upper GIT bleeding can be caused by a variety of factors like the peptic ulcers. These are the sores that forms in the lining of stomach or duodenum that can cause bleeding if they erode into blood vessels. Second, esophagitis. It is the inflammation of the lining of the esophagus that can lead to bleeding from small tear of erosions. The third, gastritis. That is the inflammation of the lining of the stomach that can lead to bleeding from small erosions or ulcers. The other is varices. They are the large vein in the esophagus or stomach that can rupture and cause bleeding. So the variceal bleeding, it is caused by rupture of the enlarged vein in the esophagus or the stomach, known as varices. So they generally develops in the people with the liver diseases like the cirrhosis, in which causes increased pressure in the veins of liver and the portal system. So the treatment involves controlling the bleeding and reducing the pressure in the portal system. So the treatment here uh, can be medication, surgery, transjugular, intrahepatic, portosystemic shunt placement. The non-varicose bleeding refers to bleeding from sources other than the varices, like ulcers, erosions, tears in the lining of the GIT tract. So the non-varicose bleeding is caused by the peptic ulcers or the erosive gastritis. Other causes of the upper GIT bleed could be the malarial tears. They are the tears in the lining of esophagus from the vomiting that can cause bleeding. Or cancers, tumor in the esophagus, stomach or duodenum can cause bleeding as they grow and invade the blood vessels. Or autoenteric fistula. So it is a condition where the connection is formed between the aorta, the main artery in the body, and the GIT tract. So that causes bleeding. Now, how do you differentiate upper upper GIT bleeding from the lower GIT bleeding? So the upper GI bleeding, it refers to bleeding that originates from the esophagus, stomach or the duodenum, that is the first part of the small intestine. The blood here may appear bright red or dark and may be vomited up or passed through the bowels as black tarry stools. Whereas the lower GI bleeding, it refers to bleeding that originates from the large intestine, rectum or the anus. The blood here is dark red, that is mixed with the coating of the stool. So in the summary, the upper GI bleeding presents with the dark tarry stools or vomiting of the blood, whereas the lower GIT bleeding that presents with bright red blood on the stool. Suppose a patient comes to you with the non-varicose bleeding. How will you manage that patient? The emergency management of the non-varicose upper GI bleeding typically involves several steps to stabilize the patient, control the bleeding, and prevent complication. First of all, you will establish the IVSS. The first step in the managing non-varicose bleeding is to establish IVSS to administer medicaments and fluid. So depending upon the severity of bleeding, a large bore IV catheter that may be necessary to allow for rapid volume resuscitation. Second, monitor the patient vital signs. So, in addition to monitoring the blood pressure, heart rate and oxygen saturation, central venous pressure monitoring may be necessary to guide the fluid resuscitation. So what is CVP? It is a measurement of pressure in the large veins that returns blood to the heart. It can be used as indirect measure of fluid status. Like patient with severe upper GI bleeding, the CVP monitoring may be useful to guide the fluid resuscitation and ensure that patient is receiving appropriate volume of fluids. So the CVP monitoring can be used to guide fluid resuscitation by providing an indication of whether the patient is adequately hydrated or is experiencing fluid overload. So value of 8 to 12 millimeter mercury is considered normal, while below 8 indicates dehydration and need the fluid resuscitation. So what is CVP and how it is done? CVP is the pressure in the large veins that return blood to the heart, especially the superior vena cava. The CVP is measured as a way to indirectly to assess the fluid status of patient, and it is used to guide the fluid management in the critically ill patient. So to measure CVP, what a health care provider will do, he would insert a catheter into the central vein, such as the internal jugular, subclavian or the femoral vein. The catheter is then advanced until its tip reaches to the superior vena cava, and the pressure reading they are taken using a transducer that is connected to a catheter. So this CVP measurement they are usually taken at the end of expiration with the patient that is lying flat or at 45-degree angle. So CVP monitoring is just one tool in assessing and managing fluid balance in critically ill patient. Now next what you will do, you will administer colloids. So you can give is albumin synthetic plasma expanders that may be necessary to help the restore blood volume and maintain the perfusion. PPI, they are the medication that can help reduce the acid production in the stomach, that can slow bleeding and promote healing of the ulcers. Endoscopic therapy like injections therapy or thermal coagulation that may be necessary to control bleeding and prevent rebleeding. So in case of non-vessel bleeding that do not respond to medical or endoscopic therapy, surgery may be necessary to control the bleeding or to remove the affected tissue. So while evaluating a patient with upper GI bleeding, there are several basic investigations that may be performed to assess the severity of bleeding. A CBC, if done, it is a blood test that measures the level of differential blood cells including RBC, WBC and the platelets. So in the upper GI bleeding, CBC will show a low RBC count that would indicate anemia or a low platelet count that can indicate a possible coagulopathy. Urea and electrolyte level, they are the blood tests that measure the level of different electrolytes like the sodium, potassium and chloride and the urea. That abnormal urea and electrolyte level may indicate dehydration and electrolyte imbalance that occurs due to the fluid loss. Liver function test, they are the series of the blood tests that evaluate how well the liver is functioning. Abnormal LFT may indicate liver bleeding or damage that can increase the risk of upper GIT bleeding. Prothrombin time, it is a blood test that measures how long it takes for blood to clot. Abnormal PT may result to coagulation diseases or liver dysfunction. Cross matching, it is a procedure of testing the patient blood type and compatibility. So with the potential blood transfusion. So in addition to these basic investigation, other tests like performing may be performed depending upon the suspected cause of the bleeding. So example, if a peptic ulcer is suspected, a stool test for H. pylori may be performed and upper endoscopy may be needed to visualize the ulcer and guide the treatment. Other is you can give is the oxygen in the patient with upper GIT bleeding. A supplement oxygen may be provided using a face mask. If the patient is experiencing hypoxia, that is the low oxygen level in the blood. So low oxygen occur due to the decreased oxygen carrying capacity of the blood. So what oxygen face mask can do, it can increase the oxygen saturation level and improve the tissue oxygenation. So amount of the oxygen delivered by face mask will depend upon the patient oxygen requirement that can be determined through the pulse oximeter or arterial blood gas analysis. Other thing you can do is perform an endoscopy. So what during an endoscopy procedure, a flexible tube with a camera and a light on the end, that is on the endoscope, that is inserted into the mouth or the anus through the mouth or the anus into the esophagus, stomach or the small intestine. So the endoscope will allow the healthcare provider to visualize the lining of GIT tract and identify any area of bleeding like if there is any ulcers, varices or the tumor. So if bleeding is identified, the healthcare provider may use the endoscope to provide treatment such as injecting medicaments to stop bleeding, or place clips to close off blood vessels, or cauterize the bleeding site. So in additional diagnosis such as angiography or surgery may be needed to manage the bleeding. So what are the management of the bleeding? In the case of the ulcer bleed, initial resuscitation with IV fluids, blood transfusion and other supportive measures can be given. Endoscopy is the first line diagnostic and therapeutic procedures for the patient with upper GIT bleeding due to the peptic ulcers. PPI are the usually started after the endoscopy to reduce the risk of rebleeding and promote healing. In case of the esophageal varices, resuscitation with IV fluids, blood transfusion and other supportive measures can be done. Pharmacotherapy such as the non-selective beta blockers or may be used to reduce the portal pressure and prevent bleeding. Transjugular intrahepatic portosystemic shunt may be considered to reduce the portal pressure and prevent rebleeding. In case of what is this transjugular intrahepatic portosystemic shunts? So it is a medical procedure that can help pressure in the portal vein system that carries blood from the intestine and spleen to the liver. That carries blood from the intestine and spleen to the liver. So here a bypass between the liver and the veins in the abdomen that is created, that reduces the pressure in the portal vein system and prevent the bleeding for the varices. So what you will do, a small tube that is inserted into vein into the neck and guided down into the liver and guided to the liver. The shunt is then created between the portal vein and the hepatic vein that drain blood from the liver. So that will allow blood to bypass the liver and reduce the pressure in the portal vein system. So that can prevent the bleeding from the esophageal varices. So it is generally performed under local anesthesia and can take few hours to complete. In case of erosive gastritis, resuscitation is done, endoscopy procedure is done. Treatment such as injection of epinephrine, thermal coagulation or placement of hemostatic clips can be done. PPI are usually started after the endoscopy to reduce the risk of rebleeding. Now what are the varicose and non-varicose bleeding? The varicose bleeding is caused by rupture of enlarged veins in the esophagus or the stomach, known as the varices. So that develops typically develop in people with the liver diseases like the cirrhosis that causes increased pressure in the vein of the liver and portal system. So treatment involves controlling the bleeding and reducing the pressure in the portal system. The treatment involves the endoscopic therapy, medication, or transjugular intrahepatic portosystemic shunt placement. And the non-varicose bleeding refer to bleeding from sources other than the varices like the ulcers, erosions, tears in the lining of upper GIT tract that can be caused by peptic ulcers or erosive gastritis. So what are the symptoms of acute varicose hemorrhage? There is vomiting blood, black tarry stools, lightheadedness, rapid heartbeat, and low blood pressure. Medicaments can be given like vasopressin that can be used to decrease the blood flow to the varices and reduce bleeding. Endoscopic procedures such as band ligation or sclerotherapy can be used to treat the varices by placing bands or injecting a sclerosing agent. Balloon tamponade, it is a procedure that involves inserting a tube with the balloon at the end of throat and inflating the balloon to apply pressure to the bleeding varices. So that can stop bleeding temporarily until the further treatment is given. Other is transjugular intrahepatic portosystemic shunt that we have discussed, that involves creating a bypass between the liver and the veins in the abdomen. Next comes the peptic ulcer. What is peptic ulcer? The peptic ulcer is a sore that develops in the lining of the stomach duodenum, that is the upper part of the small intestine or the esophagus. So how will you differentiate a peptic ulcer from a duodenal ulcer? Well, the peptic ulcer they can occur in the stomach or the duodenum, that is the first part of the small intestine, while the duodenum ulcer they specifically occur in the duodenum. The gastric ulcer they are located in the stomach, specifically in the lining of the stomach, while the duodenum ulcer they are located in the first part of the small intestine, known as the duodenum. So peptic ulcers they are typically caused by bacterial infection. They are associated with the H. pylori or long-term use of NSAIDs drugs such as aspirin or ibuprofen. Other risks of peptic ulcers are the smoking, excess alcohol consumption, and the stress. So what you will see in the patient with a peptic ulcer, you will see abdominal pain, nausea, vomiting, bloating, heartburn, and the loss of appetite. Some patients may experience weight loss or blood in their stool. So treatment of the peptic ulcers depend upon the underlying cause. So we can give antibiotics to treat the H. pylori infection. We can discontinue the use of NSAIDs, reducing the dose that may be necessary if they are the cause. We can uh, reduce the amount of the acid in the stomach, such as we can give is the proton pump inhibitors PPI or H2 blockers that can relieve the symptoms and promote the healing of the ulcers. So the main difference between the peptic ulcers and duodenal ulcers is lie in the location. Peptic ulcers they can cause burning pain in the stomach that may be worsened when the stomach is empty or at night. The pain is relieved by eating or taking antacids. In contrast, duodenal ulcer they tends to cause pain in the upper abdomen that may be relieved by eating or taking antacids. The pain may occur after a few hours after eating and may also wake a person at night. So both the peptic and the duodenal ulcer they are caused by bacterial infection with the H. pylori and the use of the NSAIDs. So you should understand how H. pylori causes peptic ulcers. So when the bacteria it infect the lining of stomach or the duodenum, they will cause inflammation and damage to the protective mucus layer, allowing the stomach acid to reach the lining, and that acid can cause a ulcer. So H. pylori is spread through the contact with the contaminated food, water, or the objects. This bacteria can survive in the acidic environment of the stomach and can even penetrate the protective mucus layer. Uh, so it may be seen where the sanitization may be poor and access to healthcare may be limited. So how can you diagnose this H. pylori? Through a blood, stool, or breath test. So what is this breath test? Uh, the H. pylori breath test it is a non-invasive diagnostic test that is used to detect the presence of H. pylori bacteria in the stomach. The test is based upon the fact that H. pylori produces a specific enzyme. What is that enzyme? That is urease. So these enzymes would break down the urea in the stomach to produce carbon dioxide and the ammonia. So during the breath test, what a person will do, he will drink a solution containing small amount of urea that has been labeled with a special carbon atom. So if the H. pylori is present in the stomach, the urease enzyme that will break down the labeled urea and produce the labeled carbon dioxide that can be detected in the person breath. So this is all about the urease breath test. Other test we can do is the H. pylori stool test, also known as fecal antigen test. So what is this test? The test works by detecting antigen that are produced by H. pylori in the stool. So sample of stool will be collected and sent to the laboratory for analysis. The analysis the sample is analyzed for the presence of H. pylori antigens using a kit. If the H. pylori antigens are detected that confirm that a person has H. pylori infection, it may produce a false negative result sometimes if the person has taken antibiotic or proton pump inhibitor that can affect the accuracy of the test. So what should be your goal? The goal should be to completely eliminate the bacteria from the stomach or the duodenum. So what would be the treatment of choice here? You can use antibiotic and medication that reduce the amount of acid in the stomach, like the proton pump inhibitor or H2 blockers. What is the standard treatment for H. pylori eradication? It involves a 7 to 14 days course of antibiotic that consists of triple regimen therapy. So 3 antibiotics we use: amoxicillin, clarithrol or metronidazole. Twice a daily for 7 to 14 days. Now, what is the virulence factor for the H. pylori? The gene that is the gene that contribute the H. pylori to cause disease is CAGA gene, CAGA gene. This gene has been associated with increased risk of peptic ulcer disease and gastric mucosa associated lymphoid tissue, lymphoma. So this gene can be detected by the molecular techniques. The techniques are the PCR based assay. Now, what are the surgical treatment of the peptic ulcers? The surgery is generally not the first line treatment for the peptic ulcers, as most the ulcers can be effectively treated with medication and the lifestyle modification. So, however, a surgeon can plan for the surgical procedure for peptic ulcer. The most common procedure that surgeon use is gastrectomy. So, during the gastrectomy, the surgeon will remove some part or all the part of the stomach depending upon the location and severity of the ulcers. Other surgical part for the peptic ulcer is vagotomy. So here the surgeon will cut the vagus nerve that controls the production of the stomach acid. So what this acid will do? This helps to reduce the acid secretion that can promote healing of the ulcers. In addition to the gastrectomy and vagotomy, the other procedure a surgeon can perform is pyloroplasty. So what is that? That is done to improve the pyloroplasty will widen the opening between stomach and the small intestine. Or he can do enterectomy that removes the lower part of the stomach, where mostly the peptic ulcers occur. Now, important part that you have to remember is what is Zollinger-Ellison syndrome. It is a disorder that is characterized by the overproduction of gastrin, a hormone that stimulates the production of acid in the stomach. So the excessive acid production can lead to formation of peptic ulcers in the stomach and in the small intestine. So it is caused by a tumor called gastrinoma that develops in the pancreas or the upper small intestine. Now let us discuss how this H. pylori bacteria can cause carcinoma. The H. pylori can cause carcinoma. The chronic inflammation that will be produced by H. pylori can lead to changes in the cell of the stomach line which can eventually develop into cancerous cells. So that can damage the DNA of the stomach cells that can contribute to development of the cancer. So in addition to that, H. pylori can do is it can change the acidity of the stomach. So it can create an environment that is more conducive to growth of the cancer cells. So the bacteria can also produce toxins that can damage the DNA of the stomach and produce and promote the growth of cancers. Other factors, genetic, diet, lifestyle can also play role in the development of the cancer. So what was the treatment for H. pylori? It was triple antigen regimen therapy that includes clarithromycin, amoxicillin, and metronidazole. If the initial treatment fails, what will you do? A second line treatment is also available. We can use these H2 blockers or the bismuth subsilate in that case. So lifestyle changes can be avoid foods and beverages that irritate the stomach, such as alcohol, caffeine, and spicy or acidic food. So laboratory test, they are not the diagnostic. Rather, they can be used in the conjugation with other diagnostic method like the endoscopy. Blood test can be helpful in detecting anemia in the patient with the peptic ulcers. Blood test can be used to detect the presence of H. pylori by measuring level of antibodies to the bacterium in the blood. Stool test is the choice, maybe the choice. Now, what are the treatment for the peptic ulcers we can use is antacid. How they work? They work by neutralizing the stomach acid by reducing the acidity in the stomach. So they will contain the compound containing aluminium, magnesium. So the aluminium containing antacid, they will work by binding to the acid in the stomach, while magnesium containing antacid work by neutralizing the acid. H2 receptor blockers we can use is cimetidine, ranitidine, roxetidine. How they work? They work by blocking histamine receptors in the stomach that will reduce the amount of acid produced by the stomach. The proton pump inhibitor are the omeprazole, lansoprazole, pantoprazole. So they work by blocking the enzyme hydrogen potassium ATPase that is responsible for production of acid in the stomach. We can use the sucralfate. How they work? It works by forming a protective barrier over the surface of stomach lining. So that helps to protect it from damaging effect of stomach acid. Misoprostol. How they work? By increasing the production of protective mucus in the stomach and reducing the amount of acid produced by the stomach. So it is a remember, misoprostol is a synthetic prostaglandin. Now let us discuss the lower gastrointestinal bleeding that is characterized by bleeding from the lower part of the digestive system that includes the colon, rectum and the anus. The cause could be diverticulosis, that is the inflammation or the infection of the small pouches, that is the diverticula that form in the wall of colon. Second, hemorrhoid, these are the swollen veins in the lower rectum or the anus. The third, inflammatory bowel disease. It is a chronic condition that causes inflammation of the digestive tract that can include ulcerative colitis or Crohn's disease. Colorectal cancer. It is a malignant tumor that develops in the colon or the rectum. Polyps. These are the small growths that form on the lining of the colon rectum. Angiodysplasia. It is a abnormal and fragile blood vessels in the lining of colon that can rupture and cause bleeding. Ischemic colitis. It is a condition where blood supply to colon it is reduced. that lead to inflammation and bleeding. So, what is inflammatory bowel disease? It is a chronic condition that can cause inflammation and irritation in the digestive tract and involves the large intestine and the small intestine. So, what is the difference? What is the cause of inflammatory bowel disease? It is the combination of genetic and environment factor that trigger abnormal response in the gut. There is abdominal pain, diarrhea, rectal bleeding, weight loss, and the fatigue. So, what is the difference between the Crohn and ulcerative colitis? First of all, location. The ulcerative colitis only affects the colon and the rectum, whereas Crohn disease can affect any part of the digestive tract from mouth to the anus. In ulcerative colitis, inflammation is limited to innermost portion of colon and rectum, whereas in the Crohn disease, the inflammation can extend through the entire thickness of the bowel and can involve a multiple layer of intestinal wall. So, what are the laboratory tests you can do? Is the blood test that can evaluate inflammation and anemia, as well as check for the antibodies to certain proteins that may be associated with Crohn disease. Stool test can be done to rule out the GIT symptoms such as infection and detect inflammation or blood in the stool. Endoscopy can be endoscopy procedure like colonoscopy or upper endoscopy can help to visualize the inside of GIT tract. Image scanning such as CT, MRI or ultrasound can help to evaluate inflammation and detect the complication of the Crohn disease. So there can be certain markers that can be used to including perinuclear anti-neutrophil cytoplasmic antibody. So these are the type of antibody that can be detected in blood of some people with the inflammatory bowel disease. So what are the type of endoscopy we can perform for the lower GIT bleeding? You can do is colonoscopy. So the entire length of the colon can be examined using a flexible tube with a camera and a light at the end. So it can be used to diagnose a number of conditions like diverticulosis, colitis or the colon cancer. Other we can use is flexible sigmoidoscopy that help us to examine a lower part of colon and rectum. So it is done when the bleeding is suspected to be originating in the lower part of colon or the rectum. Enteroscopy, it is a type of endoscope that allows the doctor to examine small intestine using a long flexible tube with camera and light at the end. So what are the drugs we can use? Aminosalicylates, these are the medicaments that are used to reduce the inflammation in the lining of colon and rectum. They can be given orally or rectally. Corticosteroids to reduce the inflammation, again given orally, rectally or by injection. Immunomodulators, they work by suppressing the immune system and can be used to reduce the inflammation in patient who does not respond to other treatment. Antidiarrheal agent can be given to manage the diarrhea, that is a common symptom of the inflammatory bowel disease that can be given orally or rectally. Iron supplement could be given in order to treat anemia that can occur due to the chronic bleeding or malabsorption of iron in patient with inflammatory bowel disease. Surgery may be done